Welcome back to Medical Monday here on News Channel 5 Plus. I'm Casey Mason, joined tonight with Dr. Reddy, and we're talking about something that I think a lot of folks have either dealt with or know someone who has, and that's chronic pain. Doctor, thanks for joining us.
Yeah, thanks for having me.
The first part of the show, we went ahead and kind of talked a little bit about an overview of what back pain is, and just some facts about it, maybe even some causes. And in this segment, we're going to go ahead and kind of talk about, ways you can deal with pain. But first, we do have some callers on our line we want to get to. First, I'm going to take our call from Tony, and Tony's going to tell us a little bit about maybe some questions he has for you tonight, Doctor. Tony, good evening.
Yes, ma'am.
Thanks for joining us. We have you live here on News Channel 5 Plus for Medical Monday. And what would you like to share with us this evening?
Yes, I would like to ask. I'm 61 years old. I have deteriorated disc disease and back problem and a cervical spine in my neck. And I'm wondering what kind of alternatives is there that I can get over the counter medications that can reverse this rather than have to take narcotics. And also if there's an alternative for foods or what type of exercise I could do.
Great question, and we really do appreciate you calling in tonight, Tony. Doctor, I'll let you take this.
Tony, thanks for calling in. So to answer the first question, are there alternatives to treatment? One of the first things that we'd have to do is kind of correlate your symptoms with what your imaging looks like to really determine exactly what we would do. But there are some options other than surgery and opioid pain medications. There's things like epidurals that we can do up in the neck, where we would put some steroids and some local anesthetic in to reduce the inflammation on some of the nerves. There's also something called radiofrequency ablation that we can do to remove some of the sensation from the joints where you have arthritis to reduce the pain strictly in the neck itself. And then in terms of medications other than opioid medications, there's muscle relaxers, there's medications to, again, calm the nerves that may be pinched that can cause pain into the arms. There's anti-inflammatory medications, but there's a lot more than opioids, and imaging would kind of guide us into what kind of treatment plan. In terms of exercises, again, it kind of depends on exactly what the imaging looks like. You'd want to make sure that there's no instability in the spine before we do some of the exercises, but physical therapy is one of the most important things that you can do for any type of chronic pain. It probably has the most long-term benefit for anything, and what physical therapy is really doing is it's stabilizing the spine, so it may not actually reverse what's already there, but you're going to stabilize the spine so the pain doesn't bother you as often, and you can hopefully prevent it from kind of getting worse over time as much as possible.
Lots of great information there, Dr. Reddy. Again, we appreciate your calls this evening. We do have another caller. We'll go ahead and take him here, I think, on line 1. Do we have Joe on line 1 with us tonight? All right, we'll check maybe line. Joe, are you on line 1 here for us?
I believe there's somebody else on the line. You just got to talk to me.
Okay, all right. We'll figure that out after our next break. We'll get to those calls tonight. We'll get that figured out there. But, we definitely want to hear from you this evening. And, again, this is free medical advice from an expert. Doesn't get any better than this. So we really are learning a lot tonight. I know myself, I am about, different issues dealing with chronic pain, especially relating to your back. And let's go ahead and kind of talk about that next topic I had for us. And that was, we went into the background of what exactly is back pain, how does it occur, but now the most important thing, how can we take care of this issue? And I do want to note that the Pain Management Group, you all are the longest pain management practice here in the state. That's for 25 years. Obviously something to be very proud of. Yeah,
we've been here for quite some time and things have changed over the time, but we've stuck around. Hopefully that means we're doing things the right way.
I'd say so. Well, Dr. Reddy, let's go ahead and just discuss this. What are some options, some ways we can help treat this issue?
Absolutely. So again, one of the first things that we do is start with imaging of the spine to really distinguish what the problem is. So step 1 is always figuring out what portion of the spine itself is causing the pain, and then figuring out where we can go. So when I think about treating pain in general, it's kind of doing the least invasive thing possible first and then escalating from there as we need to. So one of the first things that we do is get the imaging and then send you to physical therapy as long as that's safe to do so. And then really kind of basic medications or anti-inflammatories, some of which you can get over the counter, but there's some prescription ones that may work a little bit better that we can start in clinic. And then for patients that have muscle spasms, which are fairly common, there's a lot of great muscle relaxants, and patients are a lot of times concerned about sedation from those medications, so we're always pretty careful about that. And again, for patients that have pain that goes down the arms and from an irritated nerves, there's multiple medications that can be used for that. The most common one that people kind of hear about is gabapentin or Neurontin, and that's something that's quite commonly taken. That actually can help almost any type of chronic pain syndrome these days. So those are kind of the first things that we do, and those are things that you'd probably notice on a first visit when you come to see us. And then from there, you know, we fill in the gap with what else do we need. So we start considering things like interventional treatment. So is an epidural going to be more beneficial, or is the radiofrequencies ablation going to be more beneficial? Is something like an injection in the actual joint in the spine going to be beneficial? And then there's even more kind of advanced therapies for patients that have had previous back surgery, or even before back surgery. Sometimes when you've failed all other treatments, there's things like spinal cord stimulators that we can consider. But again, it's kind of escalating up as you need to and not doing the most invasive thing first. And then again, to fill in the gap, there are narcotic or opioid pain medications that you can use, but you know, we try to reserve that for the gap where the other things haven't quite filled it in. And then lastly, for patients that kind of are untreated with all of those options, there's surgical referral. That's an important piece of the puzzle too.
I mean, lots of great options there. That's a pretty long list. Yes. We're going to go ahead and try to take Joe here on line 1. Joe, can you hear us?
Hello.
Hi, Joe. How are you doing tonight?
Doing without.
Well, we are happy that you called in tonight, and of course you're live right now on our Medical Monday segment talking with Dr. Reddy. What do you have for us this evening? What would you like to talk about?
I've got pain in my back. It's kind of like between my hip bones. I just lay down on the edge of my bed and with my feet on the floor and lay back, and I got that pain. I usually get it from when I'm walking, like if I try and do some shopping.
Yeah.
And the doctor has put me on a medication. It's supposed to help my back pain, and it's not working. It's, oh boy, diclofenac.
Sure. So diclofenac's an anti-inflammatory. So again, imaging would be the first piece of the puzzle to really figure out. So just for example, in the low back, you know, you think about how many different things can be right in really about 2 or 3 inches in the area that you're talking about in the hip, or a lot of people call it buttock pain or hip pain or low back pain, and it's really all the same area. To different people they call it different things, but there's the facet joint, which is the joint that actually connects the vertebral bodies, or the vertebrae in the spine, all the different bones that stack on top of each other. So those are joints that can have arthritis. There's the disc in the front that can also cause back pain if that's irritated or bulged backwards. But even outside of the spine in the low back, within an inch, there's the sacroiliac joint, and that's the joint that connects the back to the pelvis. And a lot of people, especially if you have another problem and you're not walking quite the way that we're designed to walk, you can have inflammation of that joint because it'll start to rub against each other. The two bones will start rubbing against each other, causing inflammation there. And then you do have the hip joint almost an inch away from that, and the hip joint itself can cause problems. And then there's a bursa on the other side of the hip joint, which can also cause problems. So a lot of times it's a physical exam that's going to lead us into what's important. The imaging is a really important piece of the puzzle that tells us which way to go. But things like you were talking about, when you bend backwards and that causes more pain, that also leads us to think a certain way. Because if patients have more pain when they extend backwards like that, typically it's those joints in the back that are collapsing into each other and causing more pain. So, you know, the history is really important when you tell us things like that. So diclofenac is one of the pieces that we can use to help treat that, but there are a lot of other options that we'd need some imaging to kind of get to, but there's more options than that For sure.
Yeah, Joe, Tony, thank you so much for calling in tonight. We really do appreciate that. I hope, Dr. Reddy was able to help you a little bit this evening. Again, we love to hear from you. That number on your screen, 615-737-7587. We'd love to hear from you here on The Plus. Dr. Reddy, let's you touched base on this a little bit already, but walk us through, I think a lot of folks, that scary moment of you make the appointment and you want to know what exactly can I expect when I walk in the door, and some of the ways that this pain is actually diagnosed there in the office.
Sure. So, I guess I can walk you through a first visit with one of us and exactly what you can expect and what you'd expect at the end of the visit. So the first thing that we would go through is the paperwork that you fill out. And the paperwork's kind of a guide. It's your way to really explain exactly what you go through every day. So it's asking, where's the pain? Where does it go? How much does it bother you? What does it feel like? What have you tried before? So we're just trying to really understand the problem the best way that we can. So you'll fill that out, and we would take that in as one of the first things that we go over together. And then we would take any imaging that you have and try to correlate what your pain feels like to what the imaging looks like to figure out the problem. If you don't have anything and you're kind of coming to us as just saying, I've had this pain for a few weeks or a few months, and you haven't had any imaging or any workup, one of the first things you can expect is, again, imaging. You probably heard me say it a few times now, but that's just how important it is to figuring out exactly what we do. So we would start with an x-ray fairly conservatively, and as long as that looks stable and doesn't show any kind of instability of the spine, one of the first things that we would recommend leaving on your first or second visit is physical therapy again. So after we've kind of guided ourselves into what exactly the problem may be, that's when we start exploring some of the medication offerings. If you have muscle spasm or muscle tenderness on a first visit, and we can find that on an exam, that's something that we commonly would prescribe as a muscle relaxant. If you have pain that's kind of classically sciatica, as everyone calls it, or pain that radiates down the leg from the back, then gabapentin is something that we'd probably start with on a first visit. And then anti-inflammatories are kind of a mainstay of treatment. And then where we go from there really depends on, did you get better with the physical therapy and some of the really basic medications? And if not, then we typically will get something like an MRI or a CT scan. And that really gives us a lot of pictures of the spine. And that really gives us a lot of information in terms of what can be beneficial as the next step.
All right. Great to walk us through that. I think it's important that folks kind of, can prepare for what to expect when they do walk into that initial appointment. Definitely. We're going to go ahead and pause for a quick break, and we will be right back. Stay with us.